I'm going to put myself in front of the camera.
Alright, hi, I'm Cameron Quarles, and this is my informative speech on the differences between type 1 and type 2 diabetes. Type 1 and type 2 diabetes together affect 25.8 million people in the United States, and about 80 people per day are diagnosed with either type 1 or type 2. Diabetes is the term used broadly to describe both types, but it doesn't specify between the symptoms and which type each person has. Type 1 and type 2 diabetes are often confused when really they're very different. They have symptoms and lifestyles that are completely different from each other. Often when someone hears the term diabetes, they automatically think of type 2 and the symptoms and causes related to that. Without specification, they don't realize that type 1 and type 2 symptoms vary. Type 1 and type 2 are both associated with extreme thirst, frequent urination, sudden vision changes, and many other warning signs. However, sudden weight loss is only associated with type 1, and tingling or numbness or pain in the hands and feet result only from type 2. Some people with type 2 have symptoms that go unnoticed because of the mildness of them. They're not very bold, so they aren't caught. Type 1 comes on suddenly and is not preventable, or usually there's not a history of the disease in the family. It just appears from unknown factors, whereas type 2 diabetes can be genetic and is often foreseen by a doctor. Because of the sudden symptoms of type 1, it is often mistaken for other illnesses such as the flu, and this mistakenness can lead to worsening problems or even death if it is not caught. Type 2 diabetes is generally caught early by doctors and can be stopped or slowed with strict diets and medication. Living with either type of diabetes is a challenge, but the lifestyles vary dramatically. People with type 2 diabetes generally have an easier treatment plan. They can use medication, exercise, and lose weight to help cope with their blood sugars, and in some cases even reverse the effects of the diabetes. With type 1 diabetes, it's not so simple. People with type 1 must check their blood regularly before meals. They have to take insulin injections before or after each meal, depending on how many carbs and what their blood sugar level was. And some type 1 diabetics use insulin pumps, like this one. It functions similar to the pancreas, except you have to monitor everything you eat, and you still have to input it. They're developing newer versions of the pumps, but you still have to manually enter carbs and blood sugar levels in order for it to work properly. Both types of diabetes are complicated and add difficulties to a diabetic's daily routine, and they can also be very challenging and risky and dangerous to live with. Although there are many differences between type 1 and type 2 diabetes, they're often mistaken for one another. Ways to tell them apart involve looking at the symptoms and the lifestyle of the people who have diabetes. For instance, insulin pumps are only used by type 1 diabetics to regulate their blood sugar levels, because with type 2 diabetes, some people with type 2 diabetes, their pancreases still function, and it's risky to use an insulin pump because it's a constant drip of insulin, so it can be risky with the functioning pancreas. No person with type 2 should have an insulin pump, so that's an indicator of which type. Also, with type 2 diabetes, people with type 2 don't take as many insulin injections or do as many blood tests as people with type 1 diabetes. They aren't required to monitor their blood sugar as closely. Approximately 85% of type 2 diabetics are obese or overweight, so this is an indicator of which type they have. Oftentimes, type 1 diabetics will wear some form of medical identification, such as an ID bracelet, to alert medics and others of their disease. The long-term effects for both types can include damage to the heart, kidneys, eyes, feet, and hearing. And type 1 diabetics can have more traumatic consequences if they're not properly regulating their blood sugar. Although the term diabetes is used interchangeably, both type 1 and type 2 for both type 1 and type 2 diabetes, they are very different from one another, including symptom and lifestyle characteristics. People living with either type of diabetes frequently find themselves trying to explain the difference because of the lack of knowledge surrounding the subject. It is very important that we raise awareness for the differences between type 1 and type 2 because of the risks involved in not knowing the differences. This is the main focus of many diabetes foundations, such as JDRF and the American Diabetes Association. They want to educate the public so they can reduce the risks of people with type 1 or type 2 diabetes getting mixed up. If someone ever tells you that they have diabetes, it's a good idea to ask them to specify which type so you can notify someone in case of an emergency or just help prevent complications for them.